Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. I'm pleased to report that the White House and the Centers for Medicare and Medicaid Services, CMS, issued this week their final response to the White House petition calling on President Obama to rescind the local coverage determination for lower limb prostheses that was issued on July 16, 2015. As you well know, that draft policy generated tremendous controversy. It resulted in a White House petition that NAAOP created and that many other organizations contributed to in raising awareness of that petition and ultimately leading to the fact that 110,000 people signed that petition, 100,000 of which signed in the first 17 days. That obligated the White House to respond to the petition within two months. And they finally have responded. What also occurred during that time period is extensive public comments being submitted by patients and providers and rehabilitation professionals and disability community organizations and individuals from across the United States. The manufacturers of prostheses and prosthetic components were involved. Large companies like Hanger and individual practitioners and clinics across the country all banded together. The Amputee Coalition led yeoman's efforts to try to get as many organizations and individuals to sign the petition and ultimately submit comments to CMS on this draft policy. AC, as well as AOPA, even planned and ultimately conducted a protest or a rally at the Department of Health and Human Services on August 26th that drew tremendous media attention and really raised awareness of this issue. We met on that same day with senior officials at HHS and CMS to discuss this prosthetic coverage policy and alert them to the fact that if implemented as is, it would send amputees back to 1970s standards of care. I'm so pleased to announce that the decision has been made and that the White House has decided that it will not finalize the draft LCD for lower limb prostheses. That's fantastic news. That removes the immediate threat, and we're very pleased with that result. But I must say that our work is not done. In fact, the statement that the White House made almost went out of its way to say that it was that it did not necessarily mean that this policy is rescinded, and that's what we asked for, was a rescission of the policy. We're now in the process of trying to track down some questions and concerns that arose as a result of the statement that was made. We're trying to determine if CMS will take down from its website and from the DME MAC websites the draft policy so that it doesn't remain available to the public and remain available to other payers to go onto CMS's website and ultimately adopt the draft policy as if it's been finalized. We saw this occur in September with United Healthcare, which discontinued coverage after many years for an important socket technology. And we expect that we'll see more of that unless CMS takes down those policies from its website. So we're encouraging them to do that. We also have questions about a new working group that's going to be coordinated and established by CMS, which will be a federal employee working group on prosthetics. This will draw on individuals with knowledge of prostheses from the Veterans Administration, the Defense Department, the Department of Health and Human Services, other agencies that have some familiarity with prosthetics. They will meet in 2016, and their goal is to develop a consensus statement and to identify gaps in coverage, gaps in the evidence base, perhaps even suggest outcome measures and the like. We don't oppose this. We asked for additional dialogue. We are disappointed that stakeholders, external consumer and provider organizations, will not be at the table. The Federal Advisory Committee Act prohibits individual members of the public from serving on federal work groups or federal advisory boards unless they're organized in a certain way, and it's a difficult endeavor to organize a compliant work group. And so we are going to be consulted. The statement reads very clearly that patients and providers will have an opportunity for public comment on multiple occasions, but we don't know exactly what that means. We've already set up a meeting with the officials at CMS to discuss the announcement of this response to the petition and to discuss next steps. We think that there's some significant opportunity going forward, but in no way do we view this as our work being accomplished and finished on this issue. This is an issue that will be with us for months to come. So while we're grateful that the administration did not move forward with the draft LCD and has given us, if you will, a temporary reprieve, we do have concerns. We are very interested in moving forward and working on this policy in the future, and will do so with great vigor. We will be in touch when we know more. Thank you.